Psychosis in Alzheimer's disease is a grave clinical condition that comprises delusions and hallucinations occurring over the course of the disease. Those who develop psychosis in Alzheimer's disease progress more rapidly. They are aggressive, often agitated, and require antipsychotic medication for the treatment of their symptomatology. Unfortunately, antipsychotic medication is associated with an increased risk of stroke and sudden death and has a black box warning from FDA. Currently, there are no biomarkers of psychosis and Alzheimer's disease from neuroimaging data. There is some evidence that phospho-tau and other biomarkers of the primary pathology itself may be useful biomarkers in AD psychosis. One aim of this study was to determine whether a metabolic network map might exist that could be an imaging biomarker that could be used as a surrogate in treatment studies. The first step of the study was to identify a pattern, a network, and that was done utilizing an AI approach called CNN, convolutional neural networks. Convolutional neural networks was able to identify what we called the ADPN, the Alzheimer's disease psychosis network, by evaluating the visual data from healthy elderly controls, 174 scans, and 174 baseline scans from those with Alzheimer's who had become psychotic. The ADPN itself comprises a diverse set of regions that include canonical AD regions with the addition of the prefrontal cortex, the visual cortex, including the lingual gyrus, the middle and superior occipital cortex, and the striatum and sensory motor cortex. And indeed, the ADPN does progress. So over the course of the disease, ADPN scores did increase, and the scores, the ADPN quantification scores themselves, were correlated both with the cognitive rating scales, including the mini-mental, such that increased ADPN expression was correlated with decreased cognitive performance on the mini-mental, and increased ADPN expression was correlated significantly with functional impairment using the CDR. Support vector machine was able to accurately identify psychosis in AD 77% of the time from a baseline FDG PET scan with 86% sensitivity and 68% specificity. This suggests that the ADPN could be a classifier that could be used both for diagnostic utilities and for quantification for the development of novel treatments. Connectivity was increased in Alzheimer's patients with psychosis relative to Alzheimer's patients without psychosis. Connectivity was especially increased in a few nodes that have not previously been identified in Alzheimer's disease psychosis, including the supplemental motor area, which had increased connectivity with several regions, including Heschel's gyrus, the precuneus, the parietal lobe, and the temporal lobe. And this suggests the possibility that some of the symptomatology in psychotic Alzheimer's disease is driven by a network that are experiencing an accelerated neurodegeneration that in a compensatory manner become enhanced in their connectivity. In summary, this study identified a unique metabolic signature from FDG PET that is specific to those with psychosis and Alzheimer's disease that we call the ADPN, the Alzheimer's Disease Psychosis Network, that is progressive, that distinguishes those who are psychotic from those who will not become psychotic with an accuracy close to 80%. It's a quantifiable signature that progresses over time, and within the network, there is enhanced connectivity that may be important for explaining some of the phenomenology that we see in psychotic Alzheimer's disease. Future studies employing the ADPN may include antipsychotic treatment trials that utilize the ADPN as a surrogate for psychosis severity and as a treatment outcome and as a surrogate of response over time, so that the ADPN network may evolve and change over time in response to novel antipsychotic or even traditional antipsychotic treatments, so that new therapies might be developed and utilizing the ADPN network.